Hi, I'm Dr. Veera Pandian. I'm a pediatric neurologist at Arkansas Children's Hospital, and I am joined by Dr. Sam McKinsey today. So you guys probably have heard about some of the trial results from phase 3 study on Duchenne muscular. Today we will be discussing about the muscle MRI and cardiac outcomes in that trial. So Sam, what are your thoughts on the muscle MRI data that was presented at MDA?
Yeah. So this is a outcome measure that I think is still emerging in the field. It's not something we're really familiar with looking at, but it's always nice to see when we get imaging data that tracks with sort of the functional outcome measures, which are obviously first and foremost for these patients and these families. So just on this slide, just to highlight a few things, I think starting with the actual pictures on the right, we're mostly interested in fat fraction. And as you know, Arvin, we have muscle, which shows up as black on our MRI. And then you can see the streaky white, which represents the fatty change. And that's probably most evident here on the lower right panel. And they've quantified that for us at 12% fat fraction. So let's look at the graphs themselves. So moving over, we have light pink is our delandistrogene moxeparvovec group, treated at baseline and then with a 1-year follow-up. And you can see that it's lower, the fat fraction that is lower than our placebo group treated at 1 year. And then if we take that a step further, the gene therapy treated cohorts at 2 years, they do show progression in fat fraction compared to the light pink bar, but still doing on the whole better or about the same in some muscle groups compared to placebo.
That's true. And as we start using more of skeletal MRI, I think this is actually good data in comparison with our functional data that we use. Do you do them clinically at all, or?
We don't. And I think if I had to guess, I think that would change. I would see that changing a little bit in the next 5 to 10 years, especially with all these treatment modalities. And we're trying to get as much data as we can in terms of finding out what works best, right?
Right. Also, when we have our outcome measure that are kind of challenging to, or not sensitive enough to pick up some of the differences that we see, I think these skeletal muscle MRIs would be extremely helpful. And I also remember that they had some cardiac data presented. So let's kind of dive into the cardiac.
Yeah, let's do that. So I'm going to go ahead and start on the bottom with our bar graph. So you can see here, we've got a bunch of different outcome measures that we're looking at, and we're comparing the delandistrogene moxeparvovec group with our placebo. Again, purple for treatment, gray for placebo. And across the board, if we look at left ventricular ejection fraction, diastolic volume, and systolic volume, LV mass, and working over toward the right, we don't see any big differences between our treatment group and our placebo group. And bearing in mind that this cohort was, between 4 and 8, that's kind of the best we want to see. We don't see a lot of that cardiac hypertrophy presenting this young.
Right. I think it's reassuring again to see that there's no changes in the cardiac function across the study between placebo and the treated group. Though there were cardiac events that have been reported in the program. Right. We had I think it's two myocarditis, one as part of the EMBARK 301 study, and then there was one in a prior study as depicted in the graph above this based on the troponin levels. I think those myocarditis has a substantially higher troponin level compared to the baseline and the other patients that graph that you show here. I think the other thing I also wanted to point out here is there was a patient who had troponin as high as a patient that had myocarditis, but did not have myocarditis. This highlights the how variable these troponin levels can be in patients with dystrophinopathy as part of their dystrophinopathy. I think it's critical for clinicians to remember that and kind of have a trend in their baseline even before treating these patients to see where the troponin level stands. I think overall the troponin data also was reassuring other than the myocarditis cases, and I also want to highlight that those myocarditis patients were treated and they were solved.